Let me hit the little record button. So hello, everyone. Thanks for joining us for our presentation today. We're going to talk about our acquired brain injury program. You'll hear us refer to as ABI, which I'm sure a lot of you are aware of. My name is Debbie Stanley. I'm the Director of Admissions and Marketing here at the Brewer Center. I've been here for about 2 years, but I've been in healthcare for almost 20 years. This is my first position in a SNF and long-term care facility, and I love it. I love interacting with our residents, with our staff, so it's a good place for me to be. A little info about our center. We are a 111-bed facility. We're combined of skilled, long-term care, and ABI residents. And some of our specialty services, we offer full-time physical therapy, occupational therapy, speech. We have ABI and stroke patients. We have a full-time respiratory therapist. We can do 24-hour IV care. We also can take care of trach patients. We have a certified wound nurse who's actually one of our unit managers, so we can do a lot of wound care here. And we also can see Suboxone patients who are currently established with a provider in the community. So we offer a lot of different services here at Brewer. Today's presentation will be recorded, and I will email it out after this. There is a chat option below, so if you don't want to ask a question, you can put it in the chat and we can answer it at the end, or we will open it up to Q&A and you can unmute yourself. Now I'm going to turn this over to Lizzie Whalen. She is our ABI director. She'll tell you a little bit about herself and will be presenting today's program. So thanks for joining us.
Great. Hi, everyone. Oh, sorry. My name's Lizzie. I am the director of the brain injury program, like she mentioned. I'm actually a recreational therapist, so a little unique for these parts. There's not many rec therapists out here in Maine. I've been working with brain injury populations for at least 8 years now. Done a little bit of psych work in between that, but as any of you know who worked with brain injury patients, that kind of coincides very well as well. So that's a little bit about me. I've been here at this facility for maybe 2.5 years now. We've done quite a bit to the program, and I'm pretty excited to share it with you today. So if you want to go ahead and share your screen, Debbie, and we'll get that PowerPoint going.
All right, bear with me 1 second here. Okay, share. No, cancel. Cancel. All right, now I just gotta find it. Oh, it was right there. Try it again. There it is. And share. And then, can you see it?
Mine's not loading yet. Oh, there you go. Go ahead. Throw it in presentation mode.
Yeah, it's thinking. There we go.
Isn't technology wonderful? Anyway, so like she said, we're at Brewer Rehab. So Brewer Rehab, there's quite a few different units. So we're going to focus mainly on our brain injury and stroke program. We call it our ABI program. My contact information is right there. If you have any questions afterwards or want to contact me, whether or not someone's appropriate or anything like that, like I said, it's all right there for you. And we will be sending out the PowerPoint afterwards as well. So there's my direct line phone number and my email for anything that you guys might need. As you can see, we're part of National Healthcare Associates. And we are proud to be a CARF accredited facility, as well as it was really awesome that we got rated in the US News and World Reports as one of the best short-term rehab programs for last year. So anyway, we're excited to share that too. All right, go ahead, Debbie. So we have 111 beds in this building. And we are a secured building. I know a lot of people, when they have brain injury patients, depending on what level of orientation they have, a lot of times people wonder, are they going to be safe there? What do you do to keep our wanderers from
Please
Sorry.
pick up the column part 8A.
Forgot to mute my phone. Sorry about that overhead page. But anyway, so we are a secured building. So what that means is that our wanderers would not be able to leave the building without us letting them out. All of our doors are locked, and you need a keypad to get out of the building. It is still open so they can wander and do their thing inside the building. But like I said, it is secured. So for those wandering patients that you would be concerned about, we have that capability. Our brain injury unit is a 20-bed unit. So we specifically take care of, as it said, 20 beds. All of our beds are semi-private. So we have 2 people in each room, but we're newly renovated. We have this huge living room, dining room. It's very home-like. We really try and make it feel like a fun area. So we have like a pool table that they can play with, and a TV with a couch and a living room setting, do a lot of activities down there. But like I said, it's very home-like. They can relax, they can lounge, they can hang out. We have some movie nights and things like that. So they really kind of get to feel like they can hang out down there. And it's, like I said, it's a very, very large room. And like I said, we are CARF accredited. We just got recertified a few months ago. So we're doing very well. Go ahead, Debbie. Oh, so here are some pictures. This is just one table in our living room. They decorated the windows, as you can see. It's just one area of our living room combo. Here's a picture of our rooms. New furniture, new everything. This is actually just like 1/2 of the room that you would see. So there's the second bed and everything like that in there. This is a bigger view of the other dining room, but to be honest, it's about the same size and kind of similar in the dining room section layout. The other section of our brain injury dining room is, like I said, more of like a home living room combo. And this is a picture of our OT gym. So we have, on the left, there's that door in the back. It's a huge bathroom that they can practice regular showers in. On the right, you'll see there's the stove. They have a couple machines in there. They have a lot of things that are really helpful for our therapists to work with our patients on. So in regards to our program, we really specialize in the care of people who have had brain injuries, and that can be any type of brain injury. We've had a lot of traumatic brain injury patients. We've had some non-traumatic brain injury patients. So really any type of brain injury is what we really work on. All of our staff have to be certified brain injury specialists or equivalent. So that means they're all getting lots of specialized training on how to work with these people, how to keep them safe, and how to really take care of them as best as possible and rehab them back into the community. It's a very intensive rehab program. And of course, it's designed individually for the patient. Patient-centered care is so very important, as we all know. The therapy is very intense. They get to see a lot of therapy during the day. The goal is to, of course, be discharged back into the community. So we work really hard at getting the intensive rehab that they need so that they can get back to the least restrictive setting. Go ahead, Debbie. Yep. We have a lot of services. So of course we have a physician here. We have physicians here in the building 5 days a week. They're directing the program. They're really in charge of our team meetings and everything like that. We also have 24-hour nursing, PT, OT, speech. We do have a respiratory therapist. So I know a lot of times patients with trachs or breathing difficulties would be very appropriate here because we do have that respiratory therapist in the building. We do take trach patients, and I know sometimes certain facilities are limited in that regard, but we are lucky to not be. Social services, We have our social services department. We also have an LCSW that comes in and counsels all of our brain injury patients. She's really great with everyone. We have a brain injury support group to really help with that other support and mental health side that comes with brain injuries. It's a very significant life change, and we really try and make sure that we get that all around big picture of the rehab. We have rec therapy. Like I said, I'm a rec therapist. We have several activity staff that come in and do activities every single day, large groups. We also have a neuropsychologist that comes in and consults for us, a physiatrist that comes in and consults for us. Anyone who works with brain injuries, you would know that those two are very, very important in making sure that we're getting the all around big picture for them. With the muscle tone, the physiatrist really can help us to address that. We send them out regularly for Botox, and they help to monitor the medications and everything that goes along with that. Neuropsych, they can really help us to assess what's going on with them, their rehab potential, everything like that. We do have a psychiatrist that also consults, once again, very important for our brain injury patients, and a pulmonologist that consults for us. So we have quite a lot of services. Like I said, even if they're not in the building, those consult services that do come in on site. We also have bracing and orthotics, prosthetics that come in on site. And then anything else we of course can send out for. We have transportation services that can accommodate for really any of the patient's needs. We have patients who go out regularly, every 3 days of the week for other things like, whether it's really any appointment. All right. So who do we serve? So we do only serve adults here in this building, so 18 years of age and up. If you have someone younger, we have the potential to maybe consult and see if it could be appropriate. But other than that, it's pretty much just the 18 years and up. In order to be considered for the program, they have to have some sort of diagnosis of an acquired brain injury. So whether that's, stroke, TBI, anoxia, tumors, infection, it really doesn't matter as long as there is a diagnosis of an acquired brain injury. Ideally, it's going to be a recent diagnosis. The goal for us is rehab, to getting people in, getting intensive therapy, and getting them back out to the community. So we're not really looking at brain injury as a long-term care placement. We can take brain injuries for our long-term care unit, but that's not what our brain injury program is. Our brain injury program is the rehab, the all the stuff that gets with getting them back after these significant injuries. In order to come into the program, they have to be evaluated by a neuropsychologist or a physiatrist. They have to demonstrate potential for rehab. So if they're not someone who's going to make gains, then they're not necessarily appropriate for our program. They could go to our long-term care unit, like I said before, but they really need to have the potential for rehab from a fresh brain injury, something recent, so that they can demonstrate that potential for gain. And they have to have deficits in certain areas. So they have to qualify on what's called a Mayo Portland adaptability inventory. Maximus does that through their qualification, but in order to qualify, they're going to look for a deficit in a novel problem solving, self-awareness, irritability, inappropriate social interactions, or fund of information, memory, attention, concentration. I know that's a lot, but like I said, these things, that's what qualifies someone to be on the program. And we can help you through that. If you have any questions, feel free to call. We're really good at that. All right. So speaking of that, those qualifications, if you need any help assessing whether or not someone's appropriate, like I said, feel free to call. We can help you work through that and figure out if they would meet the qualifications for the program. The other thing that we can do, I know that physiatry and neuropsychology are a little hard to come by, especially in the farther outreaches of Maine. So if you can't get them those services, what we can do is we can admit them to our skilled unit first, and we can assist with a lot of those barriers to getting them on our program, the ABI program. So we can assist with the main care application. It is a main care program. We can assist in getting the physiatry and the neuropsychology report, because we have those services that come in here every week to make sure that we get those reports that we need. So like I said, they can be admitted to our skilled unit first, and we can make sure that they qualify for the program, are evaluated for appropriateness, and can get those reports. Because like I said, we know that that can be a very big barrier. So if you have someone that you're seeing and you think that they would be appropriate for this program, you can transfer SNF to SNF and get them in here in our program first so that we can help with that. So why us? Why would you pick us? To be honest, we have a lot of really awesome things going for brain injury patients. Brain injuries is a very, very different kind of rehab. And we have therapy staff, nursing staff that specialize in brain injuries. Like I said, we have a lot of certified brain injury specialists, and if they're not, then they're certified with an equivalent program that was approved by the Office of Aging and Disability Services. It also helps because we can provide more therapy. This main care program offers us the ability to give more therapy than a lot of other insurances would approve for. I believe what it equates to is 3 hours a day, 5 days a week, for as long as they're appropriate to stay in the program, and can be very long time. And that's a lot more, like I said, than most other therapy insurances would provide for therapy. It also can provide therapy for longer. Like I said, as long as they can make gains, then we can certify them to stay in the program. And most of the time, the gains, they don't have to be like gains that you would see for most other insurance companies. It's not like they have to go from Minisys to Contact Guard or to independent. They can slowly make those gains and it still will qualify them. So we have patients who can qualify for that 5 day a week, 3 hours a day, for 6 months, a year, even longer sometimes, as long as they're continuing to make those gains. And as we know, a lot of times brain injury rehab, as much as they're not making those quick gains, they can make gains for so long. And that's what this therapy can really provide these patients, is their best chance at higher outcomes. We also have increased staffing ratios for closer observation with our brain injury patients. They're prone to being impulsive, they're prone to falls, they're prone to different things that are less than safe. And so we really have that increased staffing ratio to keep these patients as safe as possible. We have activities and rec to keep them going. Even when they're not in therapy, there's something going on in the unit, something they can participate in to keep them active, whether cognitively active, physically active, things like that, to keep them making gains even when they're not in therapy. And then we also have the mental health side of it. We have the support group to really get them to understand and to benefit. And we have an LCSW that works very closely with our brain injury patients, even some of our nonverbal ones. They have their therapy sessions and they work so hard at making sure that they're doing well. Any questions? I know that was a lot of info all at once, trying to get you, as much info as I can. So please let me know anything that I can elaborate on more for you.
Yeah, we'll open it up if someone has a question in the chat, or if you just want to unmute yourself and ask the question, we definitely will do our best to answer.
Hey, Deb and Lizzie, I just had a quick question. And I think you touched on this the second a call came in right in the middle, so you may have during that. But what role does you have a physiatrist associated with Northern Light Rehab? What role do they play in the ABI program?
Yeah, absolutely. So they're kind of the physiatrists that really make sure that all the physical gains are going to be met. A lot of times with brain injury patients, you're going to get a lot of changes in muscle tone. And so that physiatrist is going to keep a very close eye on joint integrity and braces and splints. Do they need to be on baclofen? Do they need to be on other sort of muscle maintenance medication? Do they need to go for Botox? We have a lot of patients that we send out every 3 months to see that physiatrist in her office and get those Botox injections to really assist and help them get through their therapy. If someone's so tight and spastic, they're not going to be able to participate in therapy without so much significant pain. I can't imagine being stuck in a position like this and being asked to stretch. So that Botox can really help them out. That medication can really help them out. And without that commingling with the therapies, we really wouldn't be able to get as much out of it. So that the interdisciplinary team approach is so integral with that. It's very important that we have her here, and she's wonderful. She's absolutely wonderful with our patients. Did that answer your question enough, Bob?
That did. Thank you. And what's the other question was, what is an average length of stay for somebody who comes into the ABI program?
So it's very variable. We've had some patients who have come in and been out in a month. They came in, had, multiple traumas, multiple fractures, really physically dependent on just about everything, but had super high potential and have been able to leave with contact guard independence to go home in about a month. We also have other people who have had significantly more severe of injuries. We have one guy who's still on the program, and he's been here the whole 2.5 years that I've been here, but he still continues to make those gains. So that's the really important part. And brain injury rehab is so subjective to everything about the patient, between the pre-existing conditions, the age, the severity. So it really truly depends. But I would say that's our range, the very, very large from, about 1 month to about, 2.5, 3 years.
That's great. Thank you.
That's definitely more of the outlier, the 2.5 to 3 years. A lot of people, I think the average is about 6 months, maybe a little less. 5, 6 is generally my guess.
So if you do with the ABI program, so you probably heavy concentration in neuro, et cetera, do you find that you also get a lot of patients who might be a stroke or some other type of neuro diagnosis that may not be under the quote unquote BI?
So stroke is definitely a brain injury category. It is a type of acquired brain injury, and we get a majority of our patients are actually stroke patients. I'd say we're at about 65% of our patients that come in are stroke patients. Now that other percent, it can be anything from motor vehicle accidents, TBIs, to we've had a few assaults. We've had one that was secondary to cancer. We've had quite a bit of anoxia recently, secondary to overdoses. We've had a couple infection. So really, truly, the variety of brain injury is there. There's a lot of variety. The question is just, the rehab is the same. So we can really work, or should I say very similar. So we can work through all of that neuro rehab with really any diagnosis. But yes, we have a large percentage of stroke patients.
Awesome. Thank you very much.
You're welcome. Anybody else? Any other questions? Anything I can help you with?
Okay. So
Great. And I know.
Oh, go ahead.
I was going to say, I don't think I see anything else in the chat besides what Bob already brought up. So I think we're all set. Thank you all so much for your time and all your hard work with all of our patients everywhere throughout the state. I appreciate you, and I look forward to working with you in the future.
A-Wing
Thank
Sergeant.
Thanks a lot. That was
So
great.
I will email this out. I'll also include the PowerPoint just in case you'd like to share it with anybody. And we just appreciate you guys being with us. Thank you.
Thank you. That was very informative.
Thank you.
Good, I'm glad I could help. Take care, everyone.